I think I actually have three cousins who are working directly with COVID patients, and then actually several of my family members have tested positive. But we see kind of, I think a lot of the biggest strain is coming from healthcare professionals, those on the front lines. I saw a really sad article in the New York Times about an ER doctor who committed suicide a few days ago, and she had just been kind of overwhelmed by all the death that she had seen, and by all accounts, she was actually a very sincere Christian. What are the ways in which maybe healthcare professionals might be uniquely impacted by coronavirus, and what are the ways that we can help those people who are kind of on the front lines, whether they're first responders or nurses or doctors?
Wow. Yeah, it's a good question. I mean, a lot of ways. My own sister is a physician in California, and she tested positive for the virus.
Wow.
And so, so I completely empathize with you. And I did read the article about the ER doctor and healthcare professional. And we have data on the stresses that healthcare professionals uniquely face from previous pandemics. SARS, MERS, Ebola, equine influenza. There's a really great piece out of King's College that was just published earlier this year in the UK. That's really, really interesting, and I can forward that to you guys too. But they're huge, right? Healthcare workers need to make unfortunate decisions in an environment where they are constantly exposed, and in much of the world, not well enough protected, right? Having to reuse things that were honestly designed to be single use, right? Having to not have the protective equipment that they need, having to be breathed and coughed on and all of that. And having to, in that context and environment, make decisions like who gets a respirator and who doesn't, who gets to get admitted and who doesn't, who's sick enough and who isn't, and having to live with the consequences of those decisions, right? Like, you're not sick enough today to get into the ICU because I've only got 20 beds and there's a long line, right? So I may know you have the virus, I may think you're sick, and if you came in December, I would be admitting you right now, but it's not December, it's February or it's March, and I don't have it, right? And so I have to turn you away knowing that may not go well for you. Knowing that may not go well for you, and knowing that may not go well in terms of the public health perspective too, because you're going and you're breathing and coughing and whatever, right? And touching, and I just can't, right? And so you're sitting with the knowledge of what that decision might mean for that person and for the community. And you're also sitting with this elevated baseline anxiety of, am I going to get sick? Am I going to bring whatever this is to the people that I love, right? And you're making these decisions. It's a lot of pressure, and it's unprecedented in our lifetime, right? It's unprecedented in its severity and scope, right? I mean, we can make arguments that Ebola had a better death rate or whatever, but in terms of the scope,
right? Nothing's been so global like this since at least Spanish flu, probably, right?
Yeah, which obviously none of us remember. So, but we would do well too, because the records coming out of that period actually are not as bad as we think. It's just that people don't have a great tendency to learn from history, unfortunately.
What do you mean by that? The records aren't as great as we think?
They're not as bad as we think. Like, actually, there's data. Coming out of the Spanish flu, for that pandemic from 1918, that actually shows us about why social distancing is important, why the congregation of large numbers of people is dangerous, but we don't learn as well.